Hey, podcast listeners, I'm Shawna Butler, the host of See You Now. Since launching See You Now in January of 2020, the world has entered a new era brought about by a novel coronavirus, COVID-19. And it has changed, touched, and turned upside down our lives, our work, our education systems, and our economies. It has transformed how we shop, travel, celebrate with family and friends, and indeed, how we provide and receive healthcare. In other words, COVID-19 has changed just about everything. It's ironic, maybe prescient, or perhaps just speaks to the timelessness of good public health practices that in our first episode we explored responding to and managing the outbreak of a serious communicable disease.
It takes a village to be able to care for patients with Ebola and other special pathogens. The consequences of not getting it right can be detrimental.
Our favorite phrase came from our chief nursing executive, Susan Grant, who wrote, "We can choose to fear, we can choose to care." And we chose to care.
We covered a wide array of healthcare challenges and innovations in Season 1, much of which was planned and produced prior to the worldwide spread of COVID-19. And yet, listening to the conversations, they sound both timely and timeless. We explored innovations in maternal and newborn care and the economic, social, and emotional impact of empowering women and families during the childbirth experience.
Shawna, I knew that we could make outcomes better, but this whole idea of empowerment, it was never in my vision at all. But it was put in my vision by a young African-American woman because we made a point of telling the families the difference between obstetrics, where it's generally described as doctors delivering babies, and between that and the way we saw it being done, which is we attend women while they give birth. And this young woman, when she was asked what she thought about the care that was given, she said, if you've given birth, then you've given life. And if you've given life, you can do anything.
We looked at vaccine confidence and the need to build trust with people, especially parents of young children, through listening, understanding fears and concerns, providing evidence and encouragement, and meeting people where they are. And increasingly, that's on the internet and social media.
We actually have a toolkit that is called Talking to Your Vaccine Hesitant Loved One with Compassion and Confidence.
This sounds like something that we need to do at Thanksgiving.
Well, it's really funny. I do tend to post this around the holidays as a reminder to those. So just kind of not to worry. But you have to find out why they are afraid. What's making them vaccine hesitant? Fear is very powerful. It's so powerful that sometimes even the effect of trying to ease it can be upsetting to the person controlled by it. And this is very true even when it comes to vaccines.
And from the nurses who transformed care during the HIV and AIDS epidemic in the 1980s, we learned the importance of touch to heal, to soothe, to humanize, and to revolutionize.
HIV points its finger at everything that is wrong in society. Anybody can do something, everybody can do something, and some of it is overtly political and activist, and a lot of it is just day-to-day stuff. And innovation. Nurses have been incredibly innovative, and it has transformed how hospitals work and how chronic care works.
Then, as the COVID-19 crisis spread across the globe, we pivoted to capture the stories from nurses innovating in real time to adapt to this rapidly changing environment.
COVID-19 coronavirus has accelerated the adoption of technology and, quite frankly, put a huge microscope on all of the gaps in our healthcare system in the U.S.
It's extraordinary, this virus. I've been a critical care nurse for 45 years. I've done disaster work all over the world. I've never experienced how rapidly devastating this is.
I believe that it is the nurse's duty
to educate the public.
We didn't expect the level of hostility of what we received.
One, I was surrounded by so many firearms.
I was called a murderer.
Fake nurse, you're an actor. You must work at an abortion clinic. You're a baby killer. That really hurt.
As a school nurse, we were not part of the closing, the design of it. It was clear that our voice was not included. And that cannot happen with reentry. We have to help design what needs to happen.
COVID-19 sparked a cascade of pandemics, including loneliness, isolation, and mental health. The impact has been widespread, felt by everyone across the planet. But nowhere has the mental health pandemic been more acute than amongst healthcare workers, and nurses have been hit hard. To mark National Nurses Week, we took a deep dive into the COVID-induced mental health pandemic.
Right now, nurses are pushing through. It's similar to battlefield medicine. When you're in the front line and you know that you have a war in front of you and you know you have to continue and fight through to get through this, to get to the other side, it's when things start to die down that it really starts to hit you. And I think this is what's going to happen to a lot of nurses.
Pandemics, man oh man, do they have a knack for revealing and multiplying unmet needs, gaps in care, and inequities. They're also an instigator and an accelerator of problem solving and innovation. Proof that urgency, proximity, and suffering are innovation catalysts. While we're on a short break and busy recording season 2, we'd love to hear from you and learn what challenges you're seeing and solving. Drop us an email at hello@seeyounowpodcast.com. We'll have another season ready to go in August. Until then, we invite you to keep listening or re-listen to season 1 with new ears. Share with others eager for great stories. And please take a moment to rate and review us wherever you get podcasts. It really helps millions of people find the show. For all of us at See You Now, I'm Shawna Butler. Wash your hands, mask up, stay friends 6 feet apart, and stay tuned. We'll be back soon.